Hi everyone, good afternoon.
Good afternoon.
Now on you also. Okay. So Dinesh is here with us.
Yes, sir.
Yeah, Dinesh, I'll just share the PPTs with you, right? 1 sec, I did not share. So good evening, guys. I'm Dr. Ajit, and now today is our auspicious occasion. This is the inaugural session of our record-breaking course, Basics of Cardiac Pharmacology, designed by me in the session of WIHF and Indian Pharmaceutical Association Student Forum, IPSF. So without wasting time, we will start the inauguration. I'll invite Dinesh to start the session.
Hello, everyone. I am Dinesh Kumar, doing Family 5th year. Everybody, welcome to this inaugural session of 90 days course on basics of cardiac pharmacology. I hope this session will give you some great insights. So regarding the session, organizers are CLEMED Research Solutions India in association with World Youth Heart Federation, WIHF India, and Indian Pharmaceutical Association Student Forum, IPSF.
Yes, Dinesh. Hello.
Yes, sir.
Okay. So no problem. I'll start with the introduction to all of you guys. No worries. We have started this course. We have opened the registrations in August for all of you guys, and you'll be surprised. I did not expect. Uh, in starting, I was expecting like we will get at least 500 or 1,000 admissions. And when I opened on the first day, within 2 hours, we got 2,000 admissions into this course. it was really amazing. And then we set our targets to achieve more and more, to break the records, break the Indian records. And within a week we got around 5,000 admissions. So, and we then now at the end of registrations, yesterday we have extended the dates because of lot of requests. We got around 8,500 plus unique admissions in this course. And if you look at the simple statistics, uh, I'll just share my screen so you can look at the basic statistics of the screen of this course here. Yeah, as we all can see, this is a 3 months course. Basically, there will be 12 classes, one class in a week. Every Tuesday, we'll have one class in the evening, and different speakers from the reputed speakers from the hospitals, from the national universities, from the international universities will be taking the classes. I'll be taking your classes. So it started from the CLEMED Research Solutions. I'm the co-founder and chief executive officer of CLEMED Research Solutions, and I'm also the national director for research at WIHF. So we have planned this course, and then we associated with our Indian Pharmaceutical Association Student Forum for the advertisement and for to reach the maximum students, to reach many students. Am I audible? So then we have started collaborating with the IPASF, and WIHF is our primary collaborator. So we only have decided this course, and we were just talking, I and Priyans, the president of WIHF. After that, I'll just talk a little bit about our organizers here. So we at CLEMED is a research organization expertise in providing highest level research solutions in terms of clinical research, pharmacovigilance, medical writing, data analytics, data management, and funding helps to the industries and the institutions at national and international levels. We also have a team of experts for providing training and education to the young aspirants who wants to explore the field of clinical research with career consultancy services. Globally, we are helping the students and faculties in the training programs, not only in India, even at the um, around the globe. So WIHF, World Youth Heart Federation, it is a fantastic organization. I'm telling you, we all are less than 35 years of the age here, and we have done a tremendous job. Recently, we have organized 2 weeks of the conference continuously. We have reached about more than 10,000 participants, 2 weeks conference, and almost 40 to 50 sessions, including the abstract presentations, including the webinars, workshops, and conferences. And we had record of conducting the you know uh, bioscience conference in India for first time. That was for the first time in India. So Priyans, our president WHF, will give a brief at the end. So then we have envisioned a world in which all the young members of society join hands for providing better cardiovascular health in the world, right? And IPSF, if I talk about, IPSF is the student division for Indian Pharmaceutical Association, which works all over India in big tasks. And it is they are the people, they aim to foster and escalate the pharmacist portrayal within the country and abroad, so as to encourage the pharmacy students among the country and appraise recognition, and the team is split. So vision of the course was to train. When we have started this course, we had a one vision: to train our students, whoever the student is, from medical, dental, pharmacy, cardiovascular technology, nursing, or other health or life science student. Any professional can join this course. whoever wish to learn about the cardiac drugs, wish to learn about the mechanism of action of cardiac drugs, side effects, and to know about the research outcomes. So it will helpful, it will help them in their clinical and hospital practices. And it will help in the industry settings like medical writings. And they sometimes, medical writing and pharmacovigilance, people are not from the medical background sometimes, so they also need to know about the clinical terms, medical terms. So they can learn, they can join hands with us, they can come into the course and they can learn the medical terms about the, this is specifically for cardiac pharmacology. So if they are related to cardiology anywhere in any field, they can join us. And they can practice after this course, they can practice this knowledge in their research settings, in the classes, in their clinical trials, in their if they are they want to write some publications or anything, they will get the a good insight from the cardiac pharmacology. And targeted participants were medical, dental, pharmacy, and cardiovascular technology, nursing, or from any life science students, any life science stream, all the students and professionals. Even in we have invited the delegates from the companies, from various industries, from the hospitals, from the international organizations to participate into this course. So I'll tell you some statistics about this course. You'll be wondered. We got 8,000 plus admissions. 8,000 plus admissions into this course, and you'll not believe there are 65% of female participants. So I feel women are more keen to learn about medical terms, the pharmacology and all. And the around 5,000 students are, or participants are females. Then we have around 1,000 plus working professionals, not only students, even working professionals are invited to join this course. And now we have 1,000 plus working professionals who are working in different hospitals, different organizations, as as a doctors, clinicians, physiotherapists, clinical pharmacists, and our medical representatives, and in pharmacovigilance, medical writing, different streams, different fields, different organizations they're working. So we have 1,000 plus working professionals who have registered into this course. We have 1,200 plus doctors who are working doctors, you know, who are treating patients. So it is a huge achievement, and love from them that they have joined this course. They're interested to learn something from this course. So we were even wondered, like everyone is joining from different fields. We have 250 plus dental students. We have 5,000 plus pharmacy students in this course. So uh, even 200 plus industrial delegates have joined us, and 200 plus research scientists who are doing PhD or their PDFs, or who are the full-fledged research scientists in the labs, nationally or internationally. So if I talk about the colleges, participating colleges into this course, there are more than 500 participating institutes from all the Indian states, from all the Indian states. There is no state left from where the students have not joined us, or faculties have not joined us. Everyone has joined us in this course. Like I'll tell you some names. All India Institute of Medical Sciences. From various aims, many students have joined us. From various NIPERS, National Institute of Pharmaceutical Education and Research, from NIPERS, from JIPMER Puducherry, from Manipal Academy of Higher Education, Lovely Professional University, Punjab, Amity University. So the top level institutes have joined us in this course. And names: Punjab University, APJ Abdul Kalam University, Lucknow. And in this row, you won't believe BITS Plani, BITS Mishra, BITS Mirsa, and BITS Hyderabad. And there are almost all the BITS have joined us. They're pharmacy students, and they're clinical research students, they're researchers. They all have joined hands with us and joined this course. We have faculties and students from JSS Mysore, JSS Uti, Maharishi Markandeశ్వర University, and from NITTE, from IITs, from Banaras Hindu University, government universities, very reputed names, like IITs, BHUs, Institute of Chemical Technology, Mumbai. We have people from Fortis Hospital, Apollo Hospital. We have our pharmacists and working clinicians from Medanta and many other hospitals across India. So this course has touched whatever we have expected more than that, and we all are so happy. Our team and our collaborators are now very happy, and we are very much thankful to all of you to join this course. So if we talk about the international participations, there are 20 plus countries who are participating this in this course. From there are more than 200 students, 200 more than 200 students, including faculties and their researchers and their working professionals. Even recently, yesterday, few of the people from Indian Embassy, Armenia, and few of the people from Indian Embassy, in somewhere in Gulf countries, they have joined our course. They are very much interested and they wanted to collaborate even. So we are very glad to know that people from embassies, also from Indian government and from other governments also wants to participate with us and wants to join us. So we have participants from Brazil. We have participants from African countries and Asian countries like China, Philippines, Nepal, Bhutan, Sri Lanka, Pakistan, Bangladesh, and we have people from Egypt and Israel. And except not only Asian countries, we have participants from USA, Australia, and Malaysia, Gulf countries. These are in Asia, and from Germany, Armenia, and other European Union countries. And if we look at the national international universities, including those countries, we have from the like Long Island University, Brooklyn, and Brukovinian State University, Ukraine, who has joined. From these universities, the participants have joined us in this course. And Aflediorim Kazakh National University, Kazakhstan, and Mamata Medical University, Khammam, and Dila University, Ethiopia, and King Hamad University Hospital, Kingdom of Bahrain, and University of Perpetual Health System Delta, Philippines, and Alali Hospitals, Qatar State. So we got a good amount of participants, and from various countries, from various hospitals, from various organizations across the globe. So I just wanted to thank our collaborators, Priyans Saha, who is the president and founder at WIHF, and I want to thank especially Pragna Ella. She is the president at IPASF, Indian Pharmaceutical Association Student Forum. So first, I'll call upon Priyans Saha to speak something about WIHF and about this course. Priyans, you're welcome and thank you. Priyans, hello. Priyans, you are not audible. Priyans, not audible. Your mic is off. So once this our president WIHF joins, I'll call upon Pragna if she's here. Pragna Ella, IPSF.
Hi, sir. Actually, this is Rennie, and I'm the vice chairperson from IPSF.
Hi, Rennie. Yes, thank
Hi,
you.
hi. Yeah. So I'm sorry, actually, our chairperson couldn't join this meeting because she's engaged with something else. So she just asked me to be there for the meeting.
Okay,
Yeah.
Rennie, thank you for
Yeah.
coming.
Thank you. Thank you so much.
So yeah, you can give few words about the course and about our collaboration.
Yeah. So hi everybody. My greetings from IPSF. First of all, let me take this opportunity to actually thank CLEMED for giving us an opportunity, because as you all know, IPSF is something that stands for the students, and I really can't imagine anything beyond this. If something, if not a course like this, will anything else bring benefit or no, a great benefit to students especially. So I think first of all we should be grateful and place our gratitude for getting us collaborated with such a beneficial thing course like this for the students. So thank you so much to the organizers and everyone. Yes, this indeed, it also helped us to reach out to many students. So through something like this, it also gave us a platform to reach out to students, and even they could get to know about us, how we were working for their benefits. So yes, it was beneficial for all of us. So altogether, the motto of IPSF is to do good for the students, to be beneficial to students. So I think in that case, CLIMID has given us an opportunity, and we're really happy about getting collaborated. And as far as what I have known and heard from, be it my chairperson or be it from what you have come forward sharing with us, I definitely have the confidence that this is going to get a lot of benefit for students. So I think we can have a blind trust that.
It's very difficult.
Sorry about that. Yeah.
Can you please
So
keep your mics off, other participants? Yeah, yeah, please, Rennie.
yeah. So yes, so what I was telling is about the course. I think with whatever we have got to know, I think this is something really best, and the need of an hour for anyone with in the field of pharmacy or medicine or anything related to medicine, be it medical, paramedical, even allied health sciences these days are having a lot of scope. And I think this kind of course is going to help the students in a lot of way. And considering the pandemic situation now going on, where everything is going digital, virtual, and everything is at the fingertips of students through immense screens. So taking this as an opportunity, I think this is really the best. I should actually say the bestest opportunity any student can get to learn these days. So with that note, I think this is definitely an opportunity is lost if any student doesn't get registered to this, because I don't think they can get a better learning platform at the comfort of their homes at the time and space they get. So this is definitely a very great initiative by CLIMED and world, I think WIHF. So congratulations and kudos to the team who has come up with this initiative, and all the very best. And thanks for collaborating with us. I think from behalf of the entire team of IPSF, I should be thankful to you for giving us this opportunity of collaboration, and all the very best to everyone who have registered and the team who is going ahead with this initiative. Thank you so much.
Thank you, Rennie. Thank you so much. So I'll call upon Priyans from WHF. He's our president and founder uh, of WHF. Priyans, please. Yes. Priyans, I feel you are not audible again. No, you are not audible.
Can you hear me now?
Yeah, now we can hear you.
Okay, perfect. So I'm sorry for that issue. I'm sorry for the internet issue earlier.
No problem.
Yes, I'd just like to begin by thanking Dr. Ajit and the team for coming up with this course. And I'd actually like to walk through the inception and the working on of this course. So we had begun a conversation that, we're planning such a course, and we're expecting 1,000, 1,500 people to join, and, make it a good course, because this is something which is absolutely required. Pharmacology is something which comes in all healthcare professionals' lives at some point of time, be it medical students, be it pharmacy students, be it other allied healthcare workers. So this is very integral, and that was the point where we started this discussion, and when we started working on this course. And as Dr. Ajit mentioned earlier, that how this course grew and how it has already reached so many participants. So this is extremely exciting and interesting to know that with such an idea, we are being able to reach out to so many people and so many students across India. And with that, I would like to move on to a brief introduction about the World Youth Heart Federation. So the World Youth Heart Federation is a very young organization where we work on intersectoral collaboration. And by this intersectoral collaboration, we work on improving the cardiovascular health of the society. So what I mean by these terms, here intersectoral means that we work on bringing together people from all sectors, not only the normal bubble that we live in, including people from technology to medicine to nurses to other allied healthcare workers, but also including people from traditional medicine, Ayurveda, then let's say even population planning, because it is very important for us to understand that these healthcare problems uh, don't spare anyone. And there are so many people who are interested and who can invest and who can work on such organizations at a different capacity. So that is how World Youth Heart
Pharmacy.
and with this, we are very happy to collaborate with CLEMED in this course, and we are looking forward to an amazing time in the next couple of months. So thank you so much once again, and congratulations for everyone who participated. We're going to have a great time ahead. So Dr. Ajit, over to you.
Hello, madam. Good evening, madam. Good evening, madam.
एक मिनिट रे बाबा माके कॉन्फरन्स असेल ना काय एक मिनिट हा उरलो नाही तर कसं की उरलो का ते
Hello. Now, yeah, I'm sorry, my mic was off. So now I welcome Dr. Padmanabh Kamath, sir. He is with us. Hello, sir. Good evening.
Hello. Good evening.
Sir. So Dr. Padmanabh Kamath is a professor and head of department at Kasturba Medical College, Mangalore. Sir is here to bless us for our course. We are starting. So, sir, I'll just give you the brief introduction about the course.
Yeah.
So, sir, this is about the basics of cardiac pharmacology, and in this course, we have, till date around 8,500 registrations. So it's a huge success, and now we are still getting on these registrations and admissions into the course. We have almost 20 plus participating countries, and almost 500 plus institutes from India have joined us. Sir, your words, and we are very much inspired by your societal works and your hospital practices, as you are doing great in the ECG distribution program in rural Karnataka to reduce down the cardiac complications and cardiac mortalities and acute MIs and all. So sir, your insight please.
Yeah, thank you, Ajit. I think at the outset, I would like to thank you for hosting a program of this magnitude. I think you are going live on YouTube also, I presume.
Yes, sir.
Yeah, it's a great initiative. I congratulate you.
Thank you, sir.
And, pharmacotherapy and pharmacodynamics are, integral part of our armamentarium, especially for a cardiologist. Having a knowledge of drugs is very much important. Also, our project, which you have rightly said, the ECG distribution to the rural Karnataka primary health centers.
Yes, sir.
Basically hinges on a very robust network, and also giving them the technical know-how of how to do the ECG in a patient with acute coronary syndrome or heart attack or MI for that matter,
Yes,
and also educate them on initiating therapy, especially if it is acute coronary syndrome or if it is NSTEMI or if it is a STEMI. We have to give them the clear guidelines, because most of them are general practitioners. They don't have that much in-depth knowledge of ECG, so we try to uh, educate them on ECG basics and also give them an insight into therapy aspect as well. Another aspect of our project is what is called as uh, distribution of ECG machines to the Janaushadhi. This is a dream project of our beloved Prime Minister, the PM Janaushadhi, PM BJK we call it. And
right.
this project I started almost a year back, more than a year back, where we selected a few Janaushadhi Kendras which are having large footfalls in terms of number of patients coming to the Janaushadhi, and we taught how to do ECG.
Right,
At
sir.
the same time, we capitalize on a concept where patients are happy to go to the pharmacy, but they're not so happy to come to the hospital because they feel they're all right and they don't want to see the doctor, fearing some investigations being asked on them.
Right, sir.
So we normally lose patients for follow-up, and it's more so it has got compounded with the COVID pandemic setting in. People are now averse to going to the hospital. So what happens is the follow-up is lost, and also patients are not monitored when they take therapy. So therapy is not tailored that time.
Right, sir.
So what we decided was we will give the machines to the pharmacies, or rather PM Prime Minister Bharatiya Janaushadhi Kendras,
Right, sir.
where if machines are utilized in a very constructive and systematic, orderly way, we can actually do a lot of good. So just to give you an idea of how it works, when a patient goes there who is a cardiac patient, or if he is a hypertensive diabetic, he or she can demand an ECG based on doctor's recommendation.
Right, sir.
And in case the owner of the Janaushadhi Kendra deems it necessary, or if the claim is valid, if they want an ECG, it will be done and it will be sent in a WhatsApp group exclusively done for these pharmacies, what is called as Kayakalpa group.
Okay, sir.
So
Right.
Kayakalpa is a word which is a Sanskrit word, which is elixir, for
Right,
all
sir.
the diseases. So and what we have done is now we have given ECG machines to 15 Janaushadhi Kendras all across 6 districts, neighboring districts of our Karnataka state, our South Canara district, and in Karnataka state. So what it does is, let me give you an example. Yesterday there was a patient who was having severe chest pain, and all the dispensaries were closed at around 5:15.
Right, sir.
So there was no dispensaries nearby, and ECG was not available anywhere in his small village, but it was available in the Janaushadhi Kendra. So one healthcare worker knew about it, and he alerted the patient, go to the Janaushadhi Kendra, get the ECG done.
Right,
Patient
sir.
got the ECG done. It was sent in the WhatsApp group, which is earmarked for these Janaushadhi Kendras. It was a heart attack in a 45-year-old lady, and immediately we alerted the Janaushadhi, that person, pharmacist, to quickly do necessary arrangements to shift the patient. So because they are not authorized to give medicine, so
Right, sir.
it's not like telling a doctor. So that is one limitation is there, because we cannot ask them to give the medicines, but at least we can give instructions, you see.
Right, sir.
That itself can save life. So patient was immediately shifted in an ambulance to the hospital. Here, as soon as the patient came, we attended to the patient, and a precious life is saved. So this is a job done through a Janaushadhi, where we feel pharmacy owner can do much more than just dispensing a drug or injection or any medicine.
Right.
We call it a value added service, and I hope this thing catches up in other places as well, but it requires a lot of dedication, because you'll lose another 5 or 6 minutes to do ECG, and if there is a lot of rush, some people may grumble. But what we have done is we have given it to only those people who have got a separate room for ECG, and they are committed.
Yeah, sir.
That is regarding the Janaushadhi ECG machines.
Right.
And all over Karnataka, we have kept ECG machines in around 275 primary health centers and community health centers, spanning over 21 districts of Karnataka. Another 9 districts are pending. I think because of the COVID, we were a little bit, hampered with the progress. But I think sooner or later we will make up. We should be able to complete the total 30 districts. I wish your whole program a grand success, and I'm sure I think you will have a lot more ideas and a lot more innovations being projected in this the symposium or conference which you are organizing. And I'm more than happy to give my inputs, because of the want of time, I'm not able to take active participation.
Yes.
But I thank you again for giving me this slot as a first keynote address, which I'll remember. And thank you once again. And I'm sure there are a lot of young minds, young doctors, young pharmacists, and even inventors. This is an ideal platform to launch your ideas, your whatever scientific work which you are doing. And I hope all success. Ajit, you're doing a great job. Keep
Thank you,
doing,
sir.
and God bless you.
Thank you, sir. Thank you very much. So, Pragna Rao madam is with us. I think she wants to speak. Madam.
Hello, Dr. Ajit.
Hello, ma'am.
And
Good
hello
afternoon,
to everyone else who are joining Dr. Ajit and all of us on this program today. Can you hear me?
Yes, ma'am. Ma'am, you want to add on to Dr. Pranav Kamath, sir?
Well, yes, let me begin by congratulating you on starting this course. It is the need of the hour. And online teaching learning is something which is not. So I'm very happy to see that you have very quickly embraced the new normal, which is online course delivery. I would like to say a few words about online courses. As a national coordinator of the NPTEL course, the medical courses, I had a great experience to see what happens when you roll out an online course. One of the first questions that everybody asks is, do you really think that you can learn from online courses? Is it just a waste of time, or does it really work? And in the course of my work as advisors to a lot of companies who really work in the online mode, I'd like to share a few tips with the students who are here. First of all, online learning and teaching is the new normal, and it is here to stay. And it is definitely something that will teach you if you are willing to learn. So I'll just touch upon a few points which are very important as far as online teaching learning goes. The first thing is that the main difference, I would say, between classroom teaching and online teaching is during online teaching, you must participate. If you do not participate, if you do not engage with the faculty, and if you do not engage with your peers, a lot of learning is left out. Because you see, if it's information, you can get the information anywhere. You can go to YouTube and get an information. The information is not what really helps you to learn. It is the discussion and the inputs. And I was listening to Dr. Ajit when he said that he has students across the country, across the colleges, and across different countries of the world. I don't think you'll ever get a platform like this to pool all your observations together and learn from each other. And I'm requesting Dr. Ajit and all the other faculty that you must give space to the students to exchange their ideas. And it's only in this exchange that a lot of learning happens. The second thing that I would like to tell students is something extremely boring. The boring part here is that, again, a major difference between online teaching and face-to-face teaching is, in online teaching, the student is accountable and responsible for their own learning. There is no teacher coming with a stick behind you saying study, study. Okay, and most of you all are adult learners. So that's not going to happen. So it's very easy to fall off the track. Very, very easy. If you do not keep up to what's happening on a day-to-day basis, believe me, it just takes 1 week to fall off the track. And once you fall off, it's very difficult to get on again. So you have to create what is called as a routine. That's why I said it's boring, but you must create a routine. And it's only the routine which actually keeps you in place.
Right, ma'am.
The other thing that I need to share is students who have been used to reading from books, making notes, will find that learning from online is not identical. It is not. Learning from a video is not the same as learning from a textbook. And therefore, students will have to learn how to learn during online teaching. And I say this because, see, a lot of teachers and students believe that आजकल के बच्चे तो मोबाइल लेके ही घूमते हैं, they are born with the internet, तो उनको क्या problem है?
Right.
Being on social media is different,
Right.
and learning is totally a different ballgame. So students have to know, and Dr. Ajit, I would suggest that you take a couple of, introductory classes on how to learn from a video, how to learn from online teaching, because I'm telling you, this is never taught. And this is primarily the reason why students walk away saying, "Are kuch bhi nahi sikha isme."
Right.
Because they have not been taught how to learn from an online course.
Right.
So that's very vital. And I think the last thing that I would like to add is, again, something which you may have done in your schools and colleges, group study. Okay?
Right.
So this kind of group study and social learning is very, very vital for online learning. Very vital. So you need discussion rooms, you need discussion blogs, you need breakaway rooms, you need some place where people will get together, exchange their ideas, make friends. That's very important, because the social aspect of learning is also an essential requirement. If they don't feel that atmosphere that we are a family, we are friends, we are a group, they're going to say, "Maza nahi aaya,"
Right.
So to get that into that learning, you have to create that ambience. And as teachers, what we need to learn is, how do you create an ambience where nobody can see each other?
Right.
So you need to create a party. Everyone bring your coffee mugs. Okay. And then you have a coffee break, or you have your coffee party there. But these kinds of social interactions are also very, very essential for the learning process. So you must have fun also during learning. So, Dr. Ajit, that's all from my side. And I'd really like to congratulate you and your team for this venture. I think lots more can be done. Starting from where you have started, a lot more can be done. And that your reach over the internet is now so huge that you can really bring wonderful people together and make something meaningful. So I would like to wish all the students also a very happy learning experience. I'd like to wish the teachers have a great time with all your students, and Dr. Ajit and your team, all the best.
Thank you, ma'am. Thank you very much. And actually, I forgot to introduce ma'am. I will do it now.
Okay.
So,
That's
madam
fine.
is, madam is our former dean. I was doing PhD from Kasturba Medical College. Madam was the dean there in my first year and second year. And now, madam is a medical and health professional educator. She is associated with the National Program for Technology on Technology Enhancement Learning NPTEL projected. This project is funded by government, MHRD, Government of India, and Madam has more than 30 years of teaching experience, and Madam has published more than 70 publications in research. She has done MD and then PhD, so she is very much an enthusiastic in learning and teaching. So and Madam has so many awards in her name. So she was the best dean and best teacher as per my knowledge from the KMC. So the first name came in my mind to invite was ma'am. Thank you very much, ma'am, for accepting
Most
my
welcome.
invitation.
Most welcome.
Yeah.
Wish you all
So
the best again.
thank you, ma'am. Thank you very much.
Bye.
Bye, ma'am.
Bye.
So, ma'am, 1 second. If you are, hello, ma'am.
Yeah.
So I'll just want to felicitate ma'am with the certificate. We have created a few certificates. So I'll just, yes. So this is the certificate to the madam. Madam, you will get it in the PDF format very
Okay.
soon in your email.
Thank you so much.
Thank you, ma'am.
Thank you.
Yes,
Thank
thank
you.
you, ma'am.
Bye.
Yeah, bye, ma'am. So now we have, I think, our next speaker.
Hi, I think mine is hello.
Yes,
Hi.
yes.
Yeah, very nice to see you. I think I just missed Dr. Prajna Rao. No, yeah.
Yes. Good evening, sir.
Good
So
evening. Good evening.
now we have Dr. Ranjan Sethi. Sir was the HOD of KMC when I joined PhD in Manipal, and now then sir has shifted to Mangalore. Manipal Hospitals, Bangalore. He is HOD there and professor at Manipal Hospitals, Bangalore. Sir, welcome and thank you very much for joining us.
Thank
So,
you. Thank you.
sir,
Yeah.
I want to know your experience and I want your blessings for this course.
Very nice. Very nice. And all the best, Ajit. And I'm very privileged to be here. And hello, did Mr. Dr. Rajesh leave this one or is he?
No, he's here, sir.
He's there. Very nice. Good to see him also. It's been some time since I've seen all of you. So, yeah, thank you. Thank you. Am I supposed to tell something now? Or,
Sir, yes, I want your experience from your practices, and you are the pioneer in LA appendage closure.
Yes.
So I definitely want your experience a little bit for our students and how should they go for learning, sir.
Yes.
Ranjan, it's good to see you. Hi.
Yes, very nice. Yes. Very nice. Nice seeing you. So yeah. So can you just, if it's okay with you, in a minute, can you exactly tell what they will be doing, and then I will, I'll speak.
No, sir. Actually, this is the course, as as I told you, this is about the basics of cardiac pharmacology. We are starting for the undergrads, and anyone can join from the industry, from the hospitals, pharmacy, dental, medical students. Everyone can join. So
Yes.
as of now, we have the statistics like 8,500 admissions till date.
Okay.
And we have around 1,200 plus working doctors and
Okay.
5,000 plus students, and they have joined us. And around, sir, more than 20 countries. From more than 20 countries, we have participants, and around 500 plus institutes from all over India have joined us in this course.
Okay, thank you, Ajit. And to be honest, we have quite a long association, so I can tell we expected nothing less from you. You have always been a entrepreneur and somebody who could do this. I'm happy to be part of this.
Thank you, sir.
What I want to say is pharmacology is extremely important. So there are two aspects. I think even previously when me and Dr. Rajesh shared the podium, there are two aspects which we always discuss. One is innovation of new drugs. Second, how to make, say, simple drugs like aspirin reach everywhere, So
Yes,
the science can develop only simultaneously. There's no reason to, it's like, people can't ask why should we go to space when there is poverty in the world. And, people can't ask that because the innovation is extremely important for all of us, everybody. And people should work on innovation and people should work on new drugs. So once we do that, we will be ready to face many diseases like, COVID and, even the main new challenges and new disease. If you look at COVID vaccine development, you realize it has probably come from the Ebola vaccine, So you always have to have a basic knowledge to develop your knowledge. So gone are the days where you could probably sit under apple tree and hope for the apple to fall and then, make a discovery or innovation. Those days are gone. So today we have to be up to date. Otherwise, whatever you think is already been done, you'll be just surprised. Sometime a new idea strikes to you, comes to you. When it comes to you, if you do a WebMed search or even the Google search, you realize it's already been done. There are very few new ideas, so you need to conquer all the ideas which are there and probably look for new idea. That's one point I want to make. So being up to date is very important, and the course which Ajit is giving it to you all, and where all of you, he is going to get a lot of experts who are going to be the experts. They will share their life story. They will also share how they will reach to that level, which really matters, because you need that innovation. The second aspect, which I give very, maybe equal importance, is also to make sure like aspirin, which I keep telling, to make sure aspirin is reached to everybody. That means very simple drug. We need to work on pharmacoeconomics and make sure it reaches. So these two things is something which we do. So whenever we talk about new drug, new innovation, make sure the old one don't lose this one, and they are given. Now, the third aspect probably is, how to interpret a trial. I'm sure that is the third aspect, because the statistics part of it, and how to interpret a trial. And, today's era, even with best of the knowledge, sometimes the trial may not be done in the proper way. With the recent controversies, you do realize there is lots of industry interference in trials also. So it's very important for us to probably be very, analyze. So I would actually request Ajit to make sure there are classes where you're telling them. I'm sure it's part of the curriculum, so I've not really gone through your curriculum, where you are trying to tell them evidence-based medicine. What is evidence-based medicine?
Definitely.
Not the traditional pharmacology, the
Right,
more
sir.
applied pharmacology, where you are going to talk about evidence-based medicine trials, how to do clinical trial, how to think out of the box.
Right, sir.
Tell people, most as people who are in our medical professions, we are so we keep treating patients, but trials is something where you come out of one single patient and make sure something which is applicable to a larger population. That difference is what people should learn. It's not really taught in our curriculum, unfortunately. So that difference is what people should learn. I'm sure, courses like this will really help people to understand beyond what they've, really analyze. And third, the last point may be about, in India, we do have a lot of alternative medicine which is available, but unfortunately nobody does a proper research in alternative medicine. Like, there are too many claims, so we don't know whether it is right, whether it is wrong. So at least some of you could look into doing research in those. There are, because the government is I get a lot of requests. Actually, there are Ayurvedic products which they want us to do some trial, but I'm not sure how to do it here in the setting which I am in right now. So this is something this is one scope which nobody has really worked into. If there are Ayurvedic drugs which are patented, how do we make sure that we do, see, we have knowledge of clinical trials. How do we take this knowledge and give it to them, so that, it is a win-win, nobody's asking you to do it free. So it's a win-win, and, that is something which you should look into. Because big pharma, multinational already have people to do their trial, and they know how to do it. But if you go into this field, there are so many other medicine. Some of them will be good, some of them will not be good. We are not sure which one will work. But that is the beauty of clinical trial. If you know the answer, why do you do the trial? And so we need to be unbiased. We need to be very passionate in doing the trial, but we need to be unbiased. The answer is no, you accept no. That's how you go about. And this is what we need to give it to alternative medicine in India, alternative branch of it. Make them understand it's not about being emotional, not about being claiming something. We need proof, and this is the way world works now. And let's give the proof to people. Okay.
Right, sir.
Yeah.
Thank you very much for your time, and your, you accepted my invitation, sir.
Yes.
And I'm very happy to see you here. Thank you very much.
Yes. Take care. All the best. God bless. Okay.
Thank you, sir. Thank you very much.
Dr. Rajesh, nice seeing you. I'll, catch up with you sometime. Bye.
Definitely. Thank you. It was a pleasure.
Bye.
So now I'm pleased to invite Dr. Rajesh Balkrishnan, sir. So Rajesh Balkrishnan, sir, is a PhD in public health, health services and epidemiology. He is professor of public health sciences and clinical professor of nursing at University of Virginia. And sir is a social epidemiologist whose research program focuses on medical care access, especially focused on long-term pharmacological treatment of medical conditions. He is also involved in the development of several registries for non-communicable chronic diseases globally. He has performed several comparative effectiveness evaluations for of technologies and treatments. Sir has published over 350 research papers with a high index of 63 in 2020. He has published many books and book chapters and has recognized nationally and internationally for his expertise in effective research and evaluation. So I welcome Dr. Rajesh Balkrishnan, sir. Sir, thank you very much for accepting the invitation and be here. So, sir, your expertise, please share your experience and your inputs about the course.
Ajit, first of all, thank you so much for inviting me today. I'm really happy to see you after a long time. I remember when I gave some lectures in Manipal, you were a bright, very enthusiastic student then, and I'm really happy to see that you are making a lot of strides. And I think it couldn't be timelier, because I think these days everyone is busy, everyone has a lot of things going on. So I think the wave of the future is to sort of bring education and continuing medical education to people's fingertips. Everybody, I mean, this whole COVID epidemic has kind of shown it's even forced professors and teachers like me to adapt to online teaching. At the convenience of the students, because there's no other alternative. We can't get students into the classes. We can't risk that. So so I think this is what education ultimately, I think, is going to come up to, which is basically gaining skills over a lifetime at your fingertips. And as I've kind of emphasized throughout my career and in my exams and my courses, that with this implosion, this growth of information technology, we need to slowly do away with rote learning. The old heavy textbooks and the need to memorize everything. I think what you should be more equipped is a person who has the skills to look up things when needed, provide the right advice. I think that I think is really, really important. And so I think this course and these courses that you're developing, I think is a very, very positive step in that direction, because for long I've argued that the Indian educational system is really, really outdated, because it does not sort of give you the life skills that you need to be able to successfully be a healthcare professional who is there for the patient. Dr. Ranjan Shetty also mentioned this. What is the point of learning about pharmacology if you are not able to provide access to even simple medicines to the patient? So I think trying understanding some of these issues, using health information technology, and being able to apply the knowledge and skills that you have, I think is going to be key in the future. Many times I get, in a day, I get 20 to 25 emails from students in India and other places saying, what does it take to sort of like, can we just take our PharmD and come and practice in the US? And I kind of tell them, that's not going to be so easy, because the system is totally different over here. It is more focused on applied learning. It is more focused on application of your knowledge to sort of handle day-to-day situations. So like, for example, when I have exams and stuff like that in my courses, I give students case series, and I give them a case to read and answer questions based on that. And the case is often drawn from real life. So so this is the type of skills we need to develop to sort of not only be truly knowledgeable, but also to adapt to a fast changing world. I think this COVID epidemic has really shown us how vulnerable we are. In spite of all the knowledge, all the advances in science and things like that, we are now battling a new entity that we didn't know, we had not encountered before, and we never knew would be so so powerful, so I think, yes, eventually there is probably going to be a vaccine. Eventually probably it is going to be relegated to something like the influenza virus, so this is all going to happen eventually, but what it has really shown is our inability to sort of truly adapt to the circumstances. In fact, I think these issues are all very, very real. The amount of like, for example, the amount of climate change that has happened, the amount of changes in the environment around us, these are only going to make life a little more difficult for us. We have recklessly kind of abused our natural resources, and because of that, we are going to see a surge in new infections. We are going to see organisms which have existed for a long time suddenly come back again, develop new sort of immunity response. Immune responses. So I think this is a really crucial time for us to sort of expand our knowledge, keep up to date, and actually find ways we can sort of strategically become empowered to gain and use knowledge. So to that extent, I think these type of efforts that you are pioneering are really, really very worthy. And I hope that more individuals take advantage of these type of things. I think what is important is just, even after taking such a course, it is important to realize that's not sort of the end of the road. It's just the beginning. You have to sort of use that as a stepping stone to sort of like kind of keep updated, keep adapting. And I think that is going to be the key in the future to sort of being a successful medical professional down the road. So I think one thing which you mentioned, which is really great about these online type of initiatives, is that they're not geographically limited. People from all over the world can join in. People from a variety of medical backgrounds, or even non-medical backgrounds, if they are interested, can join in these type of ventures. And I think it's important because there are sometimes we're living in an era where we are trying to bring medicine to the patient, and the more we can empower the patient to sort of take charge of his or her own health, the more it is likely that they will be able to follow medical guidelines better, to empower themselves. And there's one thing which we have shown repeatedly in many of my studies, is that even amongst cancer patients, most of my work right now focuses in the cancer space, and even amongst cancer patients, those patients who take the locus of control on themselves and say, listen, I've got this, I need to fight it, I'm in charge of my own health, they're the ones who kind of take the medicines properly. They're the ones who have longer lives. They're the ones who have better outcomes. As compared to those patients who get depressed and say, oh my God, this is the end of the road. I'm like going to just kind of give up. Life is at the end, and so on and so forth. It's the same thing about cardiovascular as well. I think I'll give you a very personal example of this with my dad. It happened 5-6 years back. And he was a healthy person, used to go for walks and everything very regularly. And, was like, and suddenly one day he came back from a morning walk and he was like kind of feeling a bit congested in his chest and stuff like that. And then, so of course, there were a lot of tests done. He was taken to Columbia Asia hospitals in Bangalore, and all that stuff was done. And they discovered, yes, he's one of his arteries is blocked and he probably needs a bypass and all these other things. but I think what happened then is like, he was so used to sort of always being healthy and always sort of like he just couldn't take that anymore, that he became depressed and stopped taking his, stopped eating food, which is the worst thing to do if you're a diabetic. Just like kind of feeling very down and out. And of course, then the whole situation in 6 to 8 months, he was gone. What I'm saying is he didn't even make it to the operating table for his bypass. So if he would have kept that frame of mind, which he would have said, I'm going to fight this, he'd be alive today, So I think it's really important for people to sort of have a positive spirit, to sort of be in charge of their health, to equip themselves with whatever knowledge that's sort of available, take advantage of these type of courses. And I think if you discover that you have a chronic medical condition, I think it is up to you. I'm not asking you to challenge the doctor, but what I'm asking you to do is to sort of to be aware of what treatment options are available for you, to make sure that if you're on different treatments, to take them properly, and make sure that you have the best outcome. Because one of the things right now with sort of the advances in medicine and taking medicine from an art to a science is that there is, unless and until you are in a very bad shape medically, and that can happen if you're really old, if you're immunocompromised, all that things can happen. But otherwise, we have developed enough medical technologies that you can lead a life. You don't have an imminent fear of death, even if you are HIV positive. If you're on the triple combination cocktail and you can monitor your viral loads, you can pretty much expect to live a full life. Yes, it won't be a life which is totally healthy. It'll be a life with some type of disability and some type of compromise, but you can continue to live. So I think this is really important, and I think these type of initiatives are really important. So I wanted to re-emphasize again that one never stops learning. One has to keep learning new things. I learn new things every day. I'm not an expert by any means. Every day I kind of learn something new that I didn't know before. So it's important to keep that learner perspective throughout your life. And I think you have to really take advantage
No, sir, I just kept muted.
advantage of whatever opportunities are offered to you. So with that, I just wanted to congratulate you on your initiative, and I kind of look forward to a lot of successes from here. Okay, so thank you for inviting me.
Sir, thank you very much for coming and accepting the invitation and your insights. It was really useful, and your blessings. So, sir, your certificate we want to deliver to you, and it will be sent by email very soon. Thank you very much.
Thank you.
Yes, sir. Thank you for joining us, sir. So now I'll call upon we have Dr. Krishna Undela, sir, with us. So he is assistant professor at Department of Pharmacy Practice, National Institute of Pharmaceutical Education and Research, Naipur, Guwahati. And he's the former assistant professor from JSS Academy of Higher Education and Research, Mysuru. Sir has done his Bachelor of Pharmacy from Sri Vidyaniketan College of Pharmacy, Tirupati, and then M.Pharm from the Naipur, Mohali in 2012, and then PhD from JSS Mysuru, 2019. And now then Sir has moved to Naipur, Guwahati. Sir, your insights, please.
Yeah. So thank you so much. Thank you for inviting me for this brief talk. And it's a very good initiative. I should appreciate all the stakeholders of this particular course. And it's an innovative thought where you want to combine all the different professions. And one good part is the pharmacology is the one subject which is going to be connect all the professions, nursing, medicine, pharmacy. So always we feel, always everyone, all the healthcare professionals are attached to the only one subject, that is pharmacology. So we have taken up a very right subject and to connect the people. And indeed, it's a very important subject as well, because being a healthcare professional, pharmacology is a one important subject all of us should have at least a basic understanding. And so with this, I congratulate all of you, and I'm hoping it is going to be a successful event. And it is not easy to conduct a 90 days event, having a different lectures from various people. And you dare to take this opportunity, and I'm sure you are going to be continue this with this collaboration, and certainly you can deliver a wonderful lectures. It's going to be useful ultimately all the stakeholders, including MBBS, pharmacy, nursing, and all other students who joined here. And the numbers you mentioned, it's very attractive. The registrations from India and all other parts of world. And I'm sure all of them are going to be learn a fruitful pharmacology, at least the basics of pharmacology through this wonderful course. So my wishes, good wishes to all of you. And thank you so much.
Thank you, sir. Thank you very much. Thank you very much, sir. So now, before concluding, I'll just go through a few instructions of the course. So guys, you can join us live in our sessions every Tuesday, 7 to 8:30. We will have the classes every Tuesday, 7 to 8:30. You can join us live on the YouTube channel. If you are engaged somewhere, you can watch our videos. These are totally digital attendance because we have subscribed to the educational channel. So don't worry about that. Your attendance will not be taken there. Your attendance will be definitely taken there, but you have to watch the full video because we have set a time marker there. At least you have to watch 75 or more than 75% of the video. Then only you will get the attendance. So after that, we have many experts and many faculties who will be taking your classes. In between, you will have one assessment test and then one final test to clear this, a certificate course. If you clear that, if you clear both the assessments, then only you will get the certificate. So be alert, be in the classes, and you have to take up all the classes, and at least 75% of the classes, 9 out of 12 classes you have to watch completely, right? So now it is the time to thank everyone. So I would like to start from our panelists, Dr. Padmanabh Kamath sir, Dr. Pragna Rao madam, and Dr. Ranjan Sethi sir, Dr. Rajesh Balkrishnan sir, and Dr. Krishna Undela sir, who has joined us for this auspicious occasion. And then I'll come to my team. We have Dr. Tarun and Dr. Karthik M here with us. They are, the directors at CLEMED Research Solutions, and we have, our student coordinators, student team members, student committee members with us, whom I really want to thank everyone. Akila, Shobit, and Dinesh, and everyone, whoever is in my team. I thank you everyone because of you only it is a huge, it is catching a huge success. If you are not there, it is not possible because you are the one behind spreading this and behind, circulating this course everywhere. And, thank you for our collaborators again. Thank you, Reni and, Yogendra. Thank you, our Pragna Ella. And thank you, Priyans and team. And, I'm a part of WIHF. So uh, I thank myself also from WHF side and from CLEMED side. And I must thank you, Dr. Kanav Khera is here with us. He is assistant professor, senior grade at Manipal College of Pharmaceutical Sciences. Sir has supported a lot with his expertise, with his experience in this course, and framing the subject, and with his inputs, it is a great success right now. So I would like to thank and invite sir also to give a little vote of thanks to everyone, sir. If sir can join me here.
Hello, yes, hello, Dr. Ajit. It's a
Thank you,
great
sir.
pleasure to be here. So, first of all, congratulations for the launch of this wonderful course.
Thank you, sir.
And I wish you all the success, and I wish all the participants a great journey for the next 90 days. And it's all the hard work of Dr. Ajit and his team. So, I just mentored them. I was a teacher of Dr. Ajit during his PharmD curriculum.
Yes.
So, and he was always very studious and very hardworking. And he has achieved a great success in his life. So I wish him all the best and wish all the luck to the CLEMED team. Okay, best wishes to all.
Thank you, sir. Thank you very much. And yes, so I'll conclude this. And thank you very much. Our next class, our first class will be at 7 p.m. today. So you guys are most welcome to join us there. Thank you. Yes, we'll see you. Bye. Take care.